Good morning. Thank you, Lisa. Good morning to all of you. Very honored to be here again as last year I was as well. Very happy to be here on behalf of the governor and working very closely with Commissioner Bennett. I want to thank our partners, the New Jersey Association of County and City Health Officials, for hosting this event. I want to thank the State Mosquito Control Commission for all the work they do. I want to thank, again, all of you in the audience here, both those working with the Mosquito Control Commissions and the health agencies across the counties and the state, for your work focusing on critical issues, especially Zika, that we all need to work on together. I want to take a moment first to thank Commissioner Bennett for her work and the cooperation we have with DEP and the rest of the state and the Mosquito Control Commission. We've got a great working relationship with the Department of Health, and her team and my team have never worked better together over the years. I've been since day one of the administration, and it's been a great working relationship with health. And again, it's back to leadership matters, so thank you. Really appreciate it, Commissioner. There are 4 quick topics I want to cover this morning. I want to cover a quick background on mosquitoes. Secondly, I'm going to talk about our statewide Mosquito Control Commission and the 21 counties. What are we doing? What are we doing annually? I want to talk about the accomplishments we have for 2016, and when I talk about what we're going to be doing this year to focus on Zika and mosquito control overall. First, let's talk about Zika and the mosquitoes that carry it. As you already know, Aedes aegypti, the mosquito that transmits Zika, is not native to the state of New Jersey and is rarely seen here. However, we have increased our vigilance so that it does not appear. We will know quickly and will take steps to control it immediately if we do see it. We take the potential threat of Zika very seriously. Although last year we avoided having Zika cases originate here in New Jersey, that does not mean we're going to let our guard down this year. So there are 63 species of mosquitoes that are native to the state of New Jersey. We're still monitoring for that 64th one and hope it doesn't come. Aedes aegypti. The Aedes aegypti is generally found in urban areas around people. It prefers indoors, near people, and breeds in standing water that accumulates in containers. It's also active during the day when female mosquitoes bite people looking for blood meal. I should also mention that the Aedes albopictus, the Asian tiger mosquito, is a relative of the Aedes aegypti and is common to New Jersey. Pretty good for a guy with an economics degree, huh? An MBA? Covered all that stuff pretty well, didn't I? The Asian tiger mosquito is also being monitored closely because it can transmit the Zika virus. While this mosquito has been found to be infected with the Zika in labs in Mexico, it is still unclear whether it is actively involved in transmitting the disease effectively. We are closely monitoring the research regarding this exotic mosquito, and will continue to monitor through that to see if we have to take additional steps related to the Asian tiger mosquito. Here in New Jersey, we have been controlling mosquito population for more than 100 years, long before Zika, so we have the expertise and the teams to be able to address mosquitoes overall. This is not new to our mosquito control agencies across the state. It's not new to us from the DEP and the State Control Commission, Mosquito Control Commission. Every year, we work with the Control Commission and all 21 county agencies to address the mosquito control and managing it through that. The county agencies are the first line of defense. They have the primary responsibility for monitoring and controlling the mosquito populations in the state of New Jersey. These programs regularly use traps to capture and count mosquitoes and to identify which species they are. When the mosquitoes are collected from the traps, each county has an expert to identify those species. They are then sent, those that are of concern are sent to 2 different labs, the state lab in Ewing or to Cape May County lab in Middle Township for testing, to see if there are any diseases they are carrying. While we're also looking for the Zika virus, we continue every year to monitor critical diseases such as Commissioner Bennett also mentioned: West Nile virus, Eastern equine encephalitis, St. Louis encephalitis, chikungunya, and dengue. If we find that the Aedes aegypti in any mosquito traps, we will take significant steps immediately to address the issue. We'll bring together and coordinate deployed resources from both the state, the counties, and other agencies to focus on that area. Spraying in that area will be with appropriate pesticides, will be focused very heavily at that point in time. We'll identify and eliminate treating standing water or any containers that are in that area. We'll deploy additional monitoring and detection equipment in that area. We'll deploy monitoring and effective response for follow-up. And again, we'll provide the guidance and communication to the local communities and the local businesses in that area. Again, we have a game plan to address the issue. In addition to trapping, counting, and identifying mosquitoes, the county agencies every year employ a variety of strategies of mosquito control. They include aerial spraying, water management programs, distributing 5 varieties of fish, which are natural predators that feed on mosquito larvae, public awareness campaigns, application of appropriate pesticides is also necessary, and those are the activities that they're all focused on. Last year, DEP and DOH made significant progress on our capacity building and monitoring efforts. We purchased additional traps, which are already being deployed, have been deployed in the field and are working. We provide additional money to the counties to meet the needs for new spraying equipment, traps, lab supplies, and seasonal help. Last year was a record setter for us out of DEP. With more than 700,000 larvae-eating fish were distributed to the counties that they've stocked in local lakes and ponds all across the state. With the mild winter, the fish stocks this year have had a high rate of survival and are still on the job. With the increased access to mosquito program, we have the ability to meet the demand in the field. In surveyed counties, we have made fish available to those counties already. 13 counties have taken us up on that already this year. We've distributed over 190,000 fish so far, and again, we're able to gear up to over 700,000 fish from our hatcheries in the state to be able to put more fish out there as the season goes on. So that was last year. Now let me talk about what we're doing this year to prepare the towns and the counties and assist the prevention of mosquitoes becoming infected with the Zika virus. This year, we have revamped and reorganized the State Mosquito Control Commission with additional commissioners put on board to replace those who had left. There's also an increased funding for the Centers of Disease Control through the Department of Health and on to DEP. We received an additional $690,000, which has gone both to the State Commission, and we moved a lot of that money down to the local counties. Again this year, DEP will provide additional traps to county mosquito control agencies. The adult mosquito surveillance program using New Jersey light traps started on May 15th. Vector surveillance monitoring for Eastern equine encephalitis starts on May 22nd. West Nile virus and other pathogens begin the first week of June. We are already seeing unusually high activity of the Eastern equine encephalitis in the northern part of New Jersey. To combat that, 100 new traps called resting boxes have been delivered to northern counties, and we will increase the testing in those counties immediately. It is also important that the programs participate in insecticide resilience screening, sharing data nationally. Insecticide and resistance training and workshops have been set up through our Office of Mosquito Control Coordination. Again, we're going to continue to monitor the data that comes in through all the county agencies all through the season. Again, we will participate and increase mosquito samples this year, so we're gearing up with both the labs, trying to make sure we have the capability necessary. The season is already underway since temperatures have already been warmer than normal especially in the month of April. So we've adjusted our resources so spraying services will meet that demand. The county mosquito control agencies are the boots on the ground to conduct the mosquito surveillance and control activities. They are absolutely the front line of work that has to be done on this, and we appreciate all the work that they do, and all of you that are from mosquito control agencies in here. I appreciate the work you do. We know what you do day to day, and I thank you for those efforts. Our Office of Mosquito Control and Coordination, under the leadership of Scott Kranz, that's Scott over there, if you need him, he's the expert in the state on mosquito control. We're here to support the counties and the efforts that you do from the science side and any kind of coordinated efforts that you need. We are engaging the public by providing information on the events and effectiveness of all the mosquito control and repellents. As you know, we have partnered with the Department of Health to promote Zika virus avoidance messages out to the public. Everyone has a role to play, including the public. We must all work together to provide that message to make sure they understand. You heard Commissioner Bennett talk about that. We need to play a role together, and it's a team effort to make that happening. We're also coordinating with the New Jersey Agricultural Experiment Station at Rutgers and the Center for Vector Biology, as well as other agencies across the country. In conclusion, people can be assured that the usual mosquito control activities are well underway from the state and the counties, coupled with our increased vigilance on Zika. That should help assure everyone that we're focused on the Zika virus, the Aedes aegypti mosquito, and make sure we're protecting the public. I thank everyone in this room for your leadership, for the work that you do, for being on the front line and coordinating with all of us to make that happen. Together, we can protect the state of New Jersey. Thank you very much.